Anxiety disorders are characterized by the experience of unpleasant tension, distress, troubled feelings, and avoidance behavior. Anxiety disorders include panic disorder, phobic disorder, agoraphobia, social phobia, claustrophobia, obsessive-compulsive disorder, post-traumatic stress disorder, and generalized anxiety disorder. Bipolar disorders are characterized by one or more manic episodes alternating with depressive episodes. A manic episode is a period during which the predominant mood is excessively elevated, expansive, or irritable. Bipolar disorder 1 is characterized by one or more manic episodes, and bipolar disorder 2 is characterized by recurrent major depressive episodes alternating with hypomanic episodes. Cyclothymic disorder is a mild form of bipolar disorder characterized by at least 2 years of numerous periods of hypomanic symptoms that do not meet criteria for mania and depressive symptoms that do not meet criteria for a major depressive disorder. Depressive disorders are the occurrence of one or more depressive episodes without a history of mania or hypomania. Major depressive disorder involves episodes of severe sadness, hopelessness, worry, and discouragement. Persistent depressive disorder is a disorder involving depressed mood that persists over a 2-year period but is not as severe as major depression. Dissociative disorder is a condition involving breakdown in memory, identity, or perception. People with this disorder escape reality through amnesia, fugue, which is sudden travel away from home or work, or alternate identities. Examples of dissociative disorders are identity disorder, dissociative amnesia, and depersonalization or derealization disorder. Eating disorders are severe disturbances in eating behavior. Examples are anorexia nervosa and bulimia nervosa. Anorexia nervosa is characterized by a refusal to maintain a minimal normal body weight. The person is intensely afraid of gaining weight and has a disturbance in perception of the shape or size of their body. Bulimia nervosa is characterized by binge eating followed by purging. Persons with bulimia maintain normal or near normal body weight. Neurocognitive disorders are marked by disturbances in cognition including thinking, perception, reasoning, and judgment. Delirium and dementia are their primary features. Delirium is acute episodes of confused thinking, disorientation, and behavioral changes. Dementia is progressive loss of intellectual abilities like judgment, memory, and reasoning, as well as changes in personality. Neurodevelopmental disorders are a group of childhood disorders characterized by delays in development and socialization and communication skills. Examples include intellectual disability disorders, communication disorders, autistic spectrum disorders, attention deficit hyperactivity disorder, specific learning disorders, and motor disorders. Personality disorders are an enduring pattern of thinking and behavior contrary to what is culturally acceptable. Personality disorders are divided into 3 clusters. Cluster A includes paranoid, schizoid, and schizotypal. Cluster B includes antisocial, borderline, histrionic, and narcissistic. Cluster C includes avoidance, dependence, and obsessive-compulsive. Schizophrenia spectrum and other psychotic disorders are chronic psychosis marked by disturbed thinking and disorganized speech. Key features that define these disorders include delusions, which are fixed beliefs that are not easy to change in light of conflicting evidence. Hallucinations, hearing voices or sounds that do not exist but seem real. Disorganized thinking, a person may switch from one topic to another, resulting in incoherent, incomprehensible speech. Abnormal motor behavior, behavior that includes involuntary movements and mannerisms from childlike silliness to unpredictable agitation. Negative symptoms, which are 2 negative symptoms that are prominent in schizophrenia, are flatness of affect and unwillingness to initiate purposeful activities. Sexual dysfunctions are disturbances in a person's ability to respond sexually or to experience sexual pleasure. Paraphilias are characterized by recurrent, intense sexual urges, fantasies, or behaviors that involve sexual objects, activities, or situations. Gender dysphoria is a strong and persistent cross-gender identification manifested in preference for dressing and gender roles that are typical for the opposite sex. There must also be evidence of distress about this difference in gender identification. With somatic symptom disorders, the patient's mental conflicts are expressed as physical symptoms. These symptoms can include abdominal pain, chest pain, nausea, vomiting, diarrhea, palpitations, deafness, blindness, and even paralysis that cannot be explained by a physical or other mental disorder. Substance-related and addictive disorders are characterized by symptoms and behavioral changes with regular use or discontinuation of substances that affect the central nervous system. Continued or periodic use of certain drugs produce a state of dependence. This can be psychological dependence, which is a compulsion to continue taking a drug despite adverse consequences, or physiologic dependence is characterized by the onset of withdrawal symptoms when the drug is abruptly discontinued. Examples of substances that are associated with drug abuse and dependence are alcohol, amphetamines, cannabis, cocaine, hallucinogens, opioids, and sedatives.